All right, it is time for us to get into the burning platform for this morning. This is what we do on a Thursday, and I'm very, very excited about our guests who will be joining us. I just want to throw this in quickly before we get to the burning platform, because Bakabantu and I asked a question, and it seems like a kind of boring surface level question, but I'm telling you, we think about this stuff more than we think about anything else, especially when it's a cold day like today. So we asked, would you rather have 34-degree summer all year or 6-degree winter all year, if those are your only two options? And it is overwhelming, I have to say. 70% of people say they would rather have summer all year, even if it was over 34 degrees. And 30% of people saying 6 degrees winter all year. Only 30%, it's a landslide. If this was an election, we would have a 2/3 majority and be able to change the constitution. So good for all the summer fans. Thank you very much. That's all we need to know. Let me welcome, of course, Kanthan Pillay, who is a regular co-host on the Burning Platform. Kanthan, you're looking silver and time honored, and full of wisdom this morning. How are you?
I'm excellent. I'm sitting in my other office out in Rudaport because I had to do the school run this morning, and
Okay.
so dropped my daughter off a full hour earlier than usual because it's the school's 10 minutes away from where I am, and
Yeah,
of course I had to transport my studio mic and so forth across to my office to rig it up here. But it all seems to be
all in the
working.
cold. All in the
Hmm.
cold, and we appreciate it. I mean, people were asking where you were the other day, and they said it's not the same without Kanthan, and they're complaining, and you know how people get. So let's get straight into it because we've got Dr. Jonathan Witt joining us in a moment or two. We want to talk about the NHI bill, and we've got someone from Joburg's council called Councillor Belinda Kayser-Echeozonjoku, who's going to tell us about the budget vote, which was conducted yesterday. But I don't know if you heard, and I know you've got lots to say about this, so I want to just open it up to you straight away before the others join us. What is going on with Donald Trump and these indictments and the fact that he's going to be arrested and they're saying he'd go to jail for 400 years? Do you have any comment on this? Is it a very, very stupid move from the Biden administration, or is it clever, brilliant politicking? What do we think?
Look, it's one of those really interesting things where the act that has been used to charge Trump was actually passed in 1917, and it's effectively an espionage act that. So it's not just simply related to the carrying of documents. Okay, they are working under the assumption that making use of these documents, in fact, was jeopardizing the lives of people in the armed forces because it purportedly contained things like battle plans to take out Iran and stuff like that.
Mhm.
And so it's a very interesting twist on things because they're not charging him on the same basis that people would be using against Joe Biden for keeping classified documents in his space. So on the one hand, it is selective prosecution. On the other hand, what it is doing is it's allowing the Democrats to play to the narrative that this man is a threat to society and should not be allowed to regain the White House no matter what. It's a very high stakes game that's being played out right now, Gareth. And
Mhm.
uh, so the question is right now whether it has any legal standing. I think it's going to go all the way to the apex court in the United States, and they're going to find in Trump's favor because ultimately, as the the commander in chief of the United States, at any given stage, quite rightly, he has the ability to say this is declassified or this is not. Does he actually have to file it and say that it was declassified? No, I don't think so. But in between, it's going to be a long process because on the assumption that he gets convicted in the primary courts, and then there'll be an appeal process, and there's an election being fought in the meanwhile. So it's long and complicated, and meanwhile, Joe Biden is continuing to stumble, and they don't have another candidate that's really capable of
No,
stepping up and taking on Trump.
when they're
Uh,
talking about Gavin Newsom, and they're talking about, I mean, there's some bizarre names that are going. Obviously, no one's talking about Kamala Harris because they would rather have no president than President Kamala. But
my
it'll be
goodness,
interesting.
yes. The interesting thing, the dark horse for me is RFK, Robert F.
Yeah.
Kennedy Jr. Uh, media is going on the US media I'm talking about is doing their damnedest to play down his numbers. And they keep saying, no, he doesn't have a hope in hell. They have a lot to say about his speech impediment.
Yeah.
But it's a very interesting turn of events in terms of RFK positioning himself exactly where he is right now. And I strongly suspect that a lot of Republicans who are frankly, I think, a bit uptight about voting for Trump because he's crass. I mean, let's be very clear. Trump is decidedly crass, and they look to RFK as a potential to fill that gap.
So I'm glad we got a chance to talk about this. We're not going to answer any serious questions about it at this point because there's so much that's still in the air. And as you say, it's a very high stakes game. So we'll have to see how it plays out. But here at home on Wednesday morning, we started the show by talking about the NHI bill, which has been passed. And I know Dr. Jonathan Witt's got some things he can and can't say. Is there anything you can't say about this, or are you allowed as a citizen to have an opinion about this, Dr. Witt? And what do we think? What do we think is actually going to happen here? This NHI bill's been passed by our moron parliament.
Before Jonathan says anything, Gareth, we need to point out that he's not a doctor. He's an acclaimed journalist.
That's correct.
Go ahead. What do you say?
I have no idea what I am and am not allowed to say because, unfortunately, the censorship model is based on the sort of timing of everything. So I assume I'm allowed to comment on this at the moment, but, who knows? Yeah, where to start with the NHI? There's a lot to it. Simply put, it is the most catastrophic piece of legislation that we have had placed in South Africa in our history. And I'd say modern history for now, but eventually it will kill more people, black and white, than apartheid. And that's just the reality. And if you think Eskom is a big deal, or you think BE has caused problems, or you think the ANC as a whole has been damaging to this country, you have no idea what will happen when we don't have healthcare. None.
So why is it so bad? I mean, that's a hell of a claim to start the show with this morning. It's the worst thing worst piece of legislation that's ever been promulgated, and we've had some pretty shitty legislation in this country. So why is it so bad? What's it going to do if it goes exactly the way we want it to?
Okay, so first, if you don't have power, you can kind of make a plan. And if you don't have water, you can probably still make some sort of plan. As people across this country, those in poverty, have had to do for decades now. And certainly a lot of us now dealing with power issues, like myself this morning, have learned to deal with. If you don't have healthcare, there is nothing you can do. If you get a disease and you are unable to get someone to treat it, or the health service that exists is unable to treat it, then you are screwed. There is nothing you can do. And that is why this is so catastrophic. And the NHI, so I suppose let's steelman the argument for a second. So a lot of people will say, well, I saw the Discovery CEO saying, don't panic. It's not a big deal. But if you listen to his comments around not panicking, a lot of that is saying things like it's going to take a long time to implement. It's very complex. It'll take, a decade or more, and it won't look like what it looks like on paper currently. And, the government will have to bring in private players or people who know what they're doing in order to get it right. Those are sort of his comments. He's not saying that this is good legislation necessarily on the face of it. He's saying there's caveats, and he believes those caveats will come into play. Those caveats have never come into play for the ANC. On any other issue, why would they here? But if you steelman the argument, a lot of people will say, well, we currently have somewhere in the region of 11 million people, between 9 and 11 million people making use of medical aids. And that's not the entire use of the private healthcare sector, I might add, because a lot of people access the private healthcare sector using cash. And furthermore, every single general practitioner is a private healthcare provider. So if you think, well, it's great, I am now going to have access to all these hospitals, which I haven't had access to because I didn't have a medical aid. Well, no, and you're probably going to have your GP taken away from you too. So there's this entire network that the theory is that poor people will now have access to healthcare, and it's not fair that we've got, say, 10 million people who have access to private healthcare and 50 million who don't, and so we're just equalizing everything.
No, so we'll basically make it everyone has no access to healthcare.
So this is the problem. The problem is you could, in theory, target giving more people access to good quality healthcare. That is what we should be doing anyway. Absolutely. You should be saying we want to be able to have all 60 million people have access to the quality of healthcare the average executive in Sandton has access to. That is a noble thing to do. And so if you engage in programs that would do that, that would be great. The problem is the NHI promises to do that by essentially bringing everyone down to the same level as the state system.
It's a standard socialist kind of thinking,
Yes,
that the pie is only so big. We now have to split it into ever smaller pieces and everyone suffers more. But at least if we're all suffering equally, then equality is more important than anyone actually getting any healthcare. So basically, we'll all be in the shitty situation.
Well, it's actually far more insidious than that, Gareth. And I just want to point out a couple of things. So I've actually devoted a chapter in my forthcoming book to the question of the National Health Insurance Bill, and I pointed out a couple of examples. So I'm just going to read you very briefly the first couple of paragraphs of it. Okay, I was in a serious accident in 1999, which left me with a broken femur, shattered humerus, 3 cracked ribs on the left and 2 on the right, and both lungs punctured.
Nonsense. You've always had a good sense of humor. Your humor.
Then in 2012, I contracted viral encephalitis. And more recently, in 2016, my youngest daughter was born 10 weeks premature and spent the next 6 weeks in neonatal intensive care unit. Today, I'm in extremely good shape for someone who's turned 61. My daughter is as happy and healthy as you'd like a 7-year-old to be. And because we were both able to access world-class treatment from the private sector, and medical aid picked up the bulk of those costs. And now we fast forward to the National Health Insurance Bill. And if it had been law during the incidents I just described, my daughter and I would be dead. Very simply, because
I think
it's very simple. Yeah,
Jonathan's not exaggerating. He's saying people it's going to cost lives.
Exactly.
So I work in public healthcare, and I think it needs to be stated that there are very good doctors, nurses, etc., healthcare providers in public healthcare, and there are times when public healthcare works as well or even better in some instances than private healthcare. For example. Well, that's one example, but I will also tell you that if you are involved in a major accident, as you describe in Kanthan, and you end up being taken to Baragwanath Hospital, the level of trauma care you will get there is no different to the level of trauma care you will get at the best trauma hospitals in this country. But that is not necessarily the case everywhere, and this is the issue. It's about the average standard. And so the average standard in public, we know, is a problem because there are pockets of excellence, obviously. But when you take it as a whole and you compare private versus public, you start to see major issues. For instance, you've never had newspaper articles about babies being put into boxes instead of incubators in the private sector, but we've had that in the public sector. You've never had examples of sort of slews of deaths happening in ICUs, either neonatal or adult ICUs in private, but you've had that in public and repeatedly, I might add. So that's the issue. But I think, Gareth, to get back to your original question, why is this so bad? I still man the argument about everyone getting good healthcare. That's the argument for. The argument against is how this actually rolls out, because there's a number of steps which don't only affect healthcare, but they destroy the economy along the way. So if you look at healthcare in the country and you say, well, we currently have we currently have all these doctors, and how it works, certainly in the private system, is the doctors work as on a fee-for-service basis. In other words, they provide you with a service, you pay them. They bill you or your funder. So usually in private, it's your funder, the medical aid. And the hospital groups will do that too. Now, the NHI aims to make that essentially an illegal relationship. Okay, the fee-for-service, the doctors, if the fee-for-service remains, and there's debate about whether doctors would be salaried rather than fee-for-service, so the government would pay them, or the hospital groups would pay them a salary to work, which would be far less than their potential earning, at least currently. Or whether the government would pay them a fee for service. But I've seen some of the initial costings that have been tabled for certain things, and I can tell you the government intends to pay 5 to 10 times less for the services of doctors than is what doctors are currently paid by sort of your standard medical aid.
I mean, it stands to reason, and nobody can fight market economics, that doctors will just leave. They will.
So this is correct.
Other things, right? So you'll just lose doctors.
This is correct. Doctors will either leave or they will no longer practice clinical medicine. Okay, so you will have a collapse in that. But there's a bigger point here, which is that we have about 9 million taxpayers, but we only have about 600,000 who are carrying the load. In other words, our 1%. Okay, and those people,
60 million people. No, 60 million people. You're saying only 600,000 are actually income taxpayers.
Yes, not only 600,000. There are roughly, according to the latest stats, somewhere around 9 million are income taxpayers. I'm saying the majority, the bulk of the money the government receives comes from about 600,000 people, and Kanthan can back me up on this.
Absolutely.
The point I'm making is those 600,000 are the professionals in this country and are the successful entrepreneurs, okay? And a large percentage of that group is doctors. So of that 600,000, I would estimate that at least 100,000 of them, paying the majority of tax in this country, are probably doctors. Right. So now you talk about losing 1/5 of your tax base when those doctors start to leave. But more
Jonathan,
so,
let's not forget the knock-on effect, okay? Because it's not just those 100,000 people. Think about all of the other people right now who continue to live in and work in South Africa because we've got access to quality health care.
So exactly, Kanthan. So you think the lawyers or the other part of the 600,000 are going to stay when there's no healthcare for them? They're not going to stay. And here's another point. The medical industry is massive. The amount of jobs that come off a single private doctor's practice is huge. I know an orthopedic surgeon who provides employment probably to about 15 different people as a result of his practice being in existence. That's one orthopedic surgeon doing that, okay? We have hundreds of them across the country. This is the level of economic destruction that will take its toll. And, people say things like, oh, well, we'll always make a plan. And I don't think that that's necessarily untrue, but you can't really make a plan for emergency healthcare. We can build hospitals in Botswana or Namibia, or maybe Mozambique gets rid of its terrorism problem and we can do that there. In fact, there are very nice hospitals. I've flown patients out of Mozambique. There's some incredible looking hospitals. There's no one in them virtually because they don't have the people to staff them. But there's some hospitals that have been built by private groups in Mozambique, for example, which, yes, you could theoretically transplant South African healthcare to. The problem is when you need to have your gallbladder out next week, Wednesday, that's not an issue. You can fly to whichever country and have your gallbladder taken out. When you have an acute problem right now, you cannot simply fly to another country to have that done. When you need chemotherapy for the next 6 months, you cannot really go to another country to have that done. If you need dialysis 4-5 times a week, you cannot simply be flying to another country or relocating to another country to have that done. The bottom line is that we should be targeting good healthcare for everyone and trying to give everyone more access to the private system or improving the public system. But that's the fundamental.
Are the medical aids, these huge big companies that offer private health insurance, are these people complicit in allowing this stupid legislation to go ahead? You remember when they made that idiot Des van Rooyen minister of finance. And the banks all stood up, went through to Jacob Zuma and said to him, if you do this, we will pull the trigger and ruin your economy, and you will be out. You will be on your ass. And it worked. They pressured him into getting, to removing Des van Rooyen. Have the medical aids stood up at all against this idiocy? Have they said anything in defense of their own existence, for God's sake? Or have they been complicit?
So I think the thing to understand there is that the biggest funder, as far as the medical aid is concerned, is Discovery Health. And, Discovery have been either pro NHI previously in several statements they've made, or they've been on the fence. I mean, what I saw from the Discovery CEO yesterday, Ryan Noach, and the day before, is it not being completely pro this NHI bill as it stands currently, but not either being completely against. The allegation against Discovery is that Discovery has either been promised or very much believes that they are positioned to be the administrator of the NHI. And if you take into account that currently they have 6 million people insured under them, or I think Ryan said 4 million people, but I think, they administrate other medical aids. They do the work for other medical aids, so they'll get a portion of that probably. But regardless, let's say 4 million people insured, and the opportunity is now to have 60 million people for which they administrate for which they take a similar fee to what they're currently taking for administrating Discovery Health members. That's a no-brainer for a businessman. If you say to a businessman, I'll give you 10 Rand for 4 million times by 4 million, or 10 Rand times by 60 million, it's a simple decision.
Right.
So no, the medical aids have not really fought back. The smaller ones may have, but they certainly haven't got any traction. I'm not aware of any of the smaller ones having made big noise about this. The hospital groups haven't either. Famously, the Life Healthcare CEO, the previous Life Healthcare CEO, a couple of years back, held a press conference with Aaron Motsoaledi, who was the health minister at the time, endorsing NHI, and they hugged each other, and that guy then got on a plane 6 months later and immigrated to Australia. So when he did that, he knew he was leaving the country, but he endorsed a system that will bring ruin to this country and the people of it. Unfortunately, no. And I'm not. I think that in some instances there is, malice by certain people, but I think there's a lot of ignorance and a lot of sort of utopian beliefs. And I just need to say one other thing, which is that this has nothing to do with healthcare for the ANC. Nothing.
No, of course
this
not.
Has everything to do with money. It really doesn't matter if in the end this creates better or worse healthcare. It's irrelevant. The first element of this is passing an income tax over and above your current income tax, which will force you to pay for the NHI. And in so doing, the rest of the NHI becomes a reality, whether they put it into law or not. And the reason for that is because once you pass an income tax, which goes onto people's PAYE, the way most people earn in this country, businesses, as they always have, will comply with the government, no matter how dictatorial or authoritarian they become. We saw that during COVID. Entire businesses were willing to shut themselves down under government fiat. Yep. And so what happens is that income tax gets passed. The majority of people on medical aids are on lower plans, meaning they can afford a couple of grand a month, but they're stretching themselves and they're not paying for the highest possible plans. And the reason medical aid and private healthcare works is based on scale. So because there are so many people on medical aids, we can make private healthcare relatively cheap, actually, in this country. Our private healthcare, for what we provide, is far cheaper than the rest of the world. Even those places, if you compare like for like, where they have public systems like the NHI,
absolutely,
we
which is why medical
good
tourism is such a thing right now, and we get a significant number of people who come in here to do procedures. And Jonathan, just in terms of the money side of things, the money that we currently pay towards those medical aids, the idea is the government will now take that out and contribute that into a pool that will go into the NHI. And over and above that, they need to find an extra 256 billion rand per year in order to fund this thing. That's what they're talking about. So not only are you losing the contributions that you're putting in to the medical aids, but you also have additional taxes
for me, Kanthan, I think we never get past that point, because what I think happens is they pass the PAYE. Everyone on the lower end plans, as I'm talking about, drops off because they can no longer afford to both pay the new tax and to pay the medical aid. The medical aids then go, okay, well, a funder like Discovery goes, we used to have 4 million people. We now have 500,000. Okay, the wealthy who pay for Discovery, top plans. And so we now have the top people, but now because there's less demand and oversupply, what will then happen is, in theory, prices will drop. But at some point, the doctors aren't going to hang around because their incomes will drop. So that the supply will quickly dwindle. And then what will happen is you'll have decreased numbers. And so the funding model will have to change. And in other words, those big plans will have to go up in price. So you won't be paying 10,000 Rand a month for a top Discovery plan anymore. You'll be paying 20 or 30. And so some of even the wealthy or this middle class will start falling off that boat. And so eventually you'll have the guys in Stellenbosch they'll be on medical aid or whatever it resembles. This is before they've even passed laws to make medical aid essentially illegal. But the medical aid system will collapse. At that point, when there's no private funding model anymore, the government, the private hospital groups as businesses will go through to the government and beg them to buy beds from them. But they'll be buying beds at probably a third of the price of what the medical funders currently pay for those beds. So the businesses, the hospital groups as businesses will just readjust their models to make sure that they can provide the service. But whereas they used to maybe replace equipment every 3 years, suddenly they'll only replace equipment every 10 years, where they used to, so the whole system will start collapsing long before any of the stuff ever goes through into some sort of enforced law. And that's why I must warn people against it will never happen because the ANC can't achieve it. It's not about achieving it. The ANC has proven again and again that they'll stick a round peg through a square hole.
Yeah, okay. I mean, this is very, very depressing, and I don't think people are adequately concerned. I don't think people are adequately concerned about what you're saying, and I think it's very, very important that everybody, what can we do? Do you go to your medical aid and say to them, listen, motherfuckers, stand up for yourselves, oppose this thing at all costs, or I'm out?
Yeah, I think that's one opportunity. I mean, how many people have ever gone to the AGM of their medical aid?
And you are a member. Yeah,
that's correct. So you can go to the AGM.
You see the difficulty again, Jonathan, in terms of the way in which one can end up approaching that is, more often than not, it's not the individual that actually contracts with the medical aid. It's the company that ends up contracting with the medical aid. And in order for the individual to then opt out, most companies don't allow you to opt out from the medical aid unless at the time of your joining the medical aid, you were able to show proof that you, in fact, already had adequate medical coverage with another medical aid. But otherwise, the ability to opt out is not there for most people. And so at that level, the medical aids effectively become a bit of a cartel because one is not able to cut ties with them unless you go through the process at a company level of actually holding a vote among all of the employees to say, we are now going to go to the medical aids and tell them that we want to cut ties with them just simply because of the fact that they are not standing up to government on this. But it's almost impossible for most people to actually go down that route.
Yeah, I mean, yes and no, Kanthan. The reality is your medical aid may be set upon you by your company who pays a portion, but that doesn't preclude you from still going to the AGM. And I must say, if thousands of people rocked up at an AGM of a medical aid, which had never had more than 100 people in the room, and all those 1,000 people were saying, you on the board will do something about this, or, we will vote you out, or whatever process needed to be followed.
Now that's a very practical suggestion. So when is the Discovery AGM?
Well, it's not only Discovery. There are other medical aids. I think we're picking on them, but
sure. But I think it's important. I think it's important to pick on Discovery because they've been the most visible ally of government in terms of this entire process. They've been the ones who've been standing up and
That's
saying,
why I asked the question. That's why
Yeah.
I didn't want us to just breeze.
So-
You know, it's fine
yeah.
for us to villainize the obvious villain, the ANC, the government in all of this. But there are people in the private sector who purport to act in our best interests and are not acting in our best interests at all. So yes, we just
and
find
we
out.
all know Discovery's record in terms of the vaccine rollout.
Right.
You know,
That's
so
bloody lunacy.
yeah, so we've got no reason to be charitable to them in particular. Jonathan, I'm taking your point that, you know, other medical aids are, you know, also should be engaged. But the fact is that the virtue signaling, by and large, has come from Discovery. And that's why I think it's particularly appropriate that Discovery becomes the starting point. And, you know, if we have a couple of thousand people pitching
yeah,
up
I mean,
at their headquarters in Sandton, I think that'll be a good thing.
Yeah, perhaps, and you know, as I say, that's one process. I think the other process, Gareth, which has been spoken about a lot by certain civil groups, is that they're going to take this to court, you know, and they're going to fight it. Number one, to tie it up in the courts for as long as possible, which is something I've heard many doctors comment on. Well, it'll take, you know, it'll be stuck in the courts forever. I think that's very hopeful. We have essentially courts that have always ruled on the side of communism. You know, even our Concourt took away land rights not too long ago. If you have minerals or resources under your land that used to be yours, that was expunged by the Concourt, and who basically said the state can take that away from you. So I don't feel that if this gets to the Concourt, for example, and the Concourt is being presented an argument by the state, which says we want to provide as many people as possible with access to healthcare, which, by the way, I must just point out, you currently have access to healthcare. Every single person that's currently in this country has access to healthcare.
Right.
We already have national health. The idea that we don't have national health is complete bullshit. If you have anything happen to you by law, and in an emergency, every single clinic and hospital in this country, including the private ones, have to treat you. So that's to start off with. And then with regards to any other medical ailment you have, you can walk into any clinic or hospital. Obviously, there's a process to follow, but you can walk into any clinic and hospital and get treatment. Now, you know, I think, you know, we've got to support these community groups and whoever else is going to get together and fight this. So if you see the likes of Sakelicha, for example, I know they're planning something. If you see they're gonna be doing this, well, it costs a lot of money to sue the government, because you know how this works. You've got to support these kinds of people.
Give them a couple of grand now if you've got it. Rather than having to pay 20,000 Rand a month in health insurance in a couple of years' time because they
absolutely right, Gareth. You know, or you know, just give them $50 a month, which is
right.
You know, enough of us end up doing that, then it actually becomes.
Well, Kanthan, I mean, AfriForum's the example here, right? There's a whole bunch of people who give AfriForum 100 Rand a month, and AfriForum manages to produce significant things for that community, and as a byproduct for many South Africans.
Well, not just for that community, for the entire South African community, from my perspective.
I don't want to be rude to our other guest who's waiting in the wings for us to talk about this 80.9 billion Rand budget that was passed by Dada Morero in the Johannesburg Metro Council yesterday. And she is a councillor herself, so we're going to get straight to her. I'm going to welcome her to the show this morning. Councillor Belinda Kayser-Echeozonjoku. Oh my God, I swore I was going to get this right. I said it right twice before, Belinda. Echezonjoku, who is our guest this morning. She is a Ward 74 councillor and DA caucus leader in the city of Johannesburg. Belinda, it's good to have you on. How are you?
Good morning, Gareth, and good morning to everyone else. Thank you very much. I'm good, thank you.
Listen, it's cold as hell in Johannesburg, but it's not as cold as the hearts of those people in the council who've asked for even more money than before. You know, I said earlier to Bakabantu, who was on the show with me, where do you actually see any evidence at all of all of this money that we've just seen voted into the hands of the Joburg Council? 80.9 billion Rand, billion with a B. A total of 166 people voted in favor of the budget, 68 voted against it. There were no abstentions. Here's what the budget, this is the top line stuff you need to know, everybody. The new budget adds 3 billion on top of the previous year's budget. So there's a little bit of inflation, but possibly no other good reason for that. The budget includes tariff hikes of 2% for property. So we're going to pay 2% more if we own property. 9.3% for water and sanitation. That's gone up, even though for many people, water and sanitation are not guaranteed. An electricity tariff of 14.97%, even though that's not guaranteed to improve any kind of quality of service delivery there, or even the accessibility to electricity. A refuse tariff of 7%, just to remove your rubbish. So what is going on here? What actually happened here? Did you oppose or did you say yes to this budget?
Well, the DA actually opposed it, and precisely because of some of the concerns you are raising. We are not seeing any of that monies, even on the previous budget, being spent among communities. I mean, for example, the city has deteriorated in a downward spiral, even in response time over the past month or two. And it's evident that nothing of that money is going to be spent. And on top of it, it's unfunded. We don't believe that it's funded. They haven't given us sufficient evidence that they have obliged with the AG's comments that was made in the reports. And that is one of the reasons why we oppose the budget. And also the ANC cannot be trusted with money. They've proven it over and over again.
Yeah, I'm sure you heard we were talking about exactly this just 5 seconds ago when it comes to NHI. All right, so where are they spending this money? Where is 80.9 billion rand going? Where do they put this? Because we certainly don't see any evidence of it.
A lot of the money is spent on job creation. We were shocked yesterday that the mayor and in the SOCA, the mayor mentioned it in the budget speech.
Sorry, Councillor. When you talk about job creation, do you mean just handing out money to people for doing fuck all, or do we actually mean promoting business?
We have yet to see what's going to happen. And that is why in my speech yesterday, I said that this is Premier Lesufi's election campaign budget, because you cannot talk about job creation at a local government level when it is a national and a provincial competency. We know that there are effects, obviously, because people are EPWP workers, but that is not really job creation. It's not eradicating poverty, and it's not the competency of local government. Local government must make sure that the streets are clean, the sewerage works, your pipe works, your electricity is done. I mean, I'm a ward councillor in Melrose, for example, and yesterday was a typical example of what I've used, that for 4 days, Birdhaven and Melrose since Saturday had been without electricity. And it's been an absolute nightmare to even get hold of officials. So you talk about job creation. Where are the officials that's supposed to answer the calls, to respond to residents? And those were it's just simple things that we cannot even get done under the ANC and its glue partners, which we call the coalition of doom and gloom. I mean, we can't get hold of anybody to get any work done.
I want to point out to people that you were also the DA's councillor in 2018 and 2021 for Cosmo City and Zandspruit, right?
Yes, I was.
So you really have, you've dealt with communities across the board in Johannesburg. Correct. In terms of rich, poor, good service delivery, poor service delivery. You've really got your hands dirty here. Okay, I'm going to let Kanthan and Jonathan ask you a few questions. I'm sure they have a few, both resident in Johannesburg. Kanthan has had many things to ask previous mayoral candidates. Of course, Belinda is not a mayoral candidate. She can't answer all the questions, but perhaps she can help with a few.
Yeah, I guess, the starting point from my side is, to what extent now is there the ability to have actual oversight on how that money is getting spent? And more importantly, is it possible for us to have constant updates that actually feed into the public domain, that show almost on a line-by-line basis exactly where the money is going to? Because I don't think we have enough of that flow of information coming out at the municipal level.
I agree with you, Kanthan, and that is yesterday, just to give you a bit of background of one of the reasons why we even opposed budget. First of all, we felt that there wasn't enough transparency in terms of the line items that we wanted to see where it will be spent. We had a meeting with the MMC of Finance on Friday as the DA. We took a whole delegation because we raised concerns because there wasn't any clarity or, clear indication of where the money will be spent. There's a lot of other items on in the line items, especially JRA. It is very difficult at the moment to get any information which should go through the Section 79, which one of your ward council, if you're a ward council, obviously your ward councillors and some of the PR councillors will sit on, and they will get those reports through the Section 79. But one of the failures that we've had recently is that the Section 79 committees have not even set. And some of those...
Just help me for a second. What is Section 79?
Okay. Section 79 is the oversight committees that is chaired by the Speaker and the Chair of Chairs. Every councillor, there's 10 portfolios in the City Council, which is headed up by MMCs. So those Section 79 committees are oversight committees that give oversight over the executive, meaning the mayor and his mayoral committee. So there's a Section 79 that literally mirrors that portfolio. And then we've also got a few oversight committees, that is the municipal accounts and also governance. So a lot of the flaws we've already picked up. Some is on governance, some of the governance issues that people were refusing to account. And if you haven't even had reports like a Section 71 report that gives a lot more detail as well, that hasn't come to council, and then they want to pass a budget. So it's very difficult to just say yes when you haven't seen what has happened, what's, line items. And when we had met with the MMC, we said to him, give us the line items as the DA so we can discuss with our caucus, and they can then have a quick discussion with their residents. Sometimes it's easy to just talk to residents associations who generally represent the residents in particular suburbs or areas. And then we can at least have an idea of where exactly the money is going. We saw line items on screens, and we asked for it to be sent to us, so we could at least have a look over the weekend. None of these was done. And yesterday, the budget was tabled, even after requests for these to be sent. So we're saying, how can we approve a budget that in the reports we have that doesn't have the line items, say that, the AG said it's made comments in the reports that were provided to us that it's unfunded. And we're not seeing the line items in detail. We want to know what we are voting for so we can explain to you as a resident.
Yeah, I'm just horrified that the Council of Johannesburg thinks it's going to be okay to tell us how much more we must pay without telling us what more we're paying for. Those line items you're talking about. It's absolutely outrageous.
Yeah.
Well, Gareth, I'm sorry, please go ahead, Councillor. That's fine. I'll go after.
I'm just, yesterday, I'm one of the most, I think, vocal ward councillors, and I fight literally every day with everybody. And one of the things I said to the MMC yesterday, it's clear that there's quite a disconnect between the mayor, the MMC of Finance, and the residents. If you cannot even attend an IDP session to hear what people are complaining about, what are the issues, what exactly informs your budget. So you have a tick box exercise, only attend certain IDP sessions that likely is only your constituency. But when you're the mayor, the MMC, you are responsible for the whole city, irrespective of people who voted for you or not. So you must give people a voice, and you must listen to people, and that we believe also haven't been done. So that's the biggest problem we have with this budget.
I mean, it's an interesting point that you raise, because I feel like there may be a little bit of throwing stones in glass houses here. You talk about giving a voice to the residents, but in Paul Palazzi, had her own issues in this regard. I mean, the DA every time it's held power in Johannesburg has passed significant increases on the budget, has increased my rates and taxes repeatedly. I haven't seen an improvement in service delivery. I had to try and get a manhole cover on Oxford Road replaced. It took 9 months for Mpho Palazi's government to do that. I have significant concerns that the DA knows how to saber rattle when they're not in power, and when they're in power, they do many of the same things. I suppose my question to you would be, other than being able to write in a line item, which is just basically incompetence on the part of the ANC, it doesn't matter. They can write in a line item for you. You still won't vote for the budget because we know they're going to steal the money. But I'm not sure what the DA does when they're in power. And my question for you is, you've been a councillor for quite a long time. Maybe next time we have a DA mayor, should it not be a councillor that has actually been on the ground for a long time instead of someone who's been elevated to that position because they dress nicely?
Parachuted in, yeah.
That applies to Mashaba and Palazzi, by the way.
I'm not going to go into the merits of being parachuted. What I can tell you, there is an advantage if you, for example, is a ward councillor or have been a councillor for some time. There is an advantage because you tend to be a bit more in touch. And I always say to people, I was a PR councillor, which is a proportional representation councillor, where I was in Cosmos City. And I exposed a lot of the corruption and also the COVID problems. And they threatened to arrest me in Dunspread and in Cosmos City over that time. It does help if you've been a councillor for some time, because it gives you at least an added advantage to be in touch. You've been in touch with the community all the time, not only when it's election time, for example. As a ward councillor, you are forced to be on the ground. Your assertion about what we do differently, or what Palazzi was doing, or our government, because I served in Palazzi's government as the MMC of Development Planning. And a lot of the issues we sat with was, it's pretty much what happened in Cape Town years when the DA first took over.
I know what you're going to say before you say it. I can complete your sentence for you. The legacy problems take a long time to get over, and it will take years to fix. Is that about right?
More or less, to an extent, but there are systems that can be changed. And I've managed to, for example, in the portfolio that I headed, it was a little bit easier. The difference with Joburg is that you're also sitting with officials that have already been placed there, that you have to deal with, and might even be hostile to this new style of governing, of people wanting to have people on the ground. And that is the difference with Joburg as well, that it's been so difficult for us to effect the changes we want to change. We had brilliant plans, and we still have, which I believe we will implement, but with officials, sorry.
No, I am interrupting, but I do want to just understand why when you're in power, or when you were in power, and perhaps the next time you are in power, it becomes so difficult to enact those changes. I'm very confused about why, for example, if there are potholes in the road, it is very hard to just fix them. That's not a legacy problem. If there's a pothole today, all right, you can literally find it on Waze, so you don't need to invest in any technology. You can open Waze and you can find all the potholes. I'm sure as a government, you could even probably go to the people who run Waze, and they'd send you a printout of the GPS locations of all of those. And then all you do is you go and you take some budget and you hire people, or you take your own people who know how to fix a road, and you send them to do it. The DA, unfortunately, wants to follow you're going to tell me that there's rules and you've got to pass it through some standing committee, and you've got to, So here's what I think as a resident: screw the rules, fix my roads.
As a resident, I would love to have exactly the same. Screw the rules and fix the potholes, but then you're going to sit with AG reports that are going to have
Who
put you
cares?
into
Who
serious
cares? What is the
trouble
consequences
with
for those AG rules?
It doesn't make any difference in other municipalities. I mean,
Yeah,
what 93% of them are bankrupt and have unclean AG reports. So who gives a shit what the AG says?
Good governance is important because, as you
Good
say,
governance is bureaucracy.
if you're
Absolutely. Good
going
governance
to
is
say go and fix the
bureaucracy.
pothole, I can get my friend to go and fix the pothole and take a kickback on that, for example. And there are reasons for rules being there. And I understand, obviously, there's better collaboration with the private sector. Could have been made much easier, which I am a big proponent of, working better with the private sector. And I think because of this red tape in government, it becomes so difficult to do it immediately. But one other thing, for example, if you talk about JRA, I don't know, obviously it's a while back, but as a ward councillor, what I've experienced at the depots, a lot of times what you would like to do at the depots, there's not even material. That we found there's no material and there's no money for the material. So even if you pass the budget, it's still not enough. The depot managers will tell you there's no material to fix the pothole. There's no tar to fix the pothole. So those are some of the legacy issues you're talking about. And it's unfortunate that even when you say, okay, there's legacy issues, let's get the private sector to come in and assist. They make it so difficult in terms of government's procurement processes to get even the private sector to come in and assist.
It's very simple to just simply get 3 quotes and go with the lowest of the quotes and get it fixed. And in terms of the officials that you are saddled with, Belinda, that you're not able to get rid of, I'm saying it's actually fairly easy to get rid of them. On day one, when you take over in the administration, you call all of those officials in and say, look, we know you were part of the previous regime. We want you out. We want to draw up a mutual separation agreement with you. And here's what we are offering you in terms of your pricing. Please pack your stuff and go. We will continue this process through the CCMA. But in the meanwhile, we're bringing in a new person. And then you go through the process in the CCMA. The CCMA is going to say, all right, this is an unfair dismissal. We need to pay this person out for 2 years. Pay the person out for 2 years. Because you're going to be in power for 5 years. It's worth it.
Call it.
I can tell you we've done that. We've done some of them. And guess what happened?
Name them.
In January, they came back. In January, they came back. When the ANC when Tapelo Ahmad was back into power, they came back and we were outvoted. We've done a few of those, especially with senior officials. What you're saying works with senior officials. But at the lower level, it's not that difficult, and that's where actually it's not that easy, and that's exactly where the service delivery happens. Then you have strikes, and you have pick it up, for example, throwing rubbish in front of your doorsteps, and we're sitting with bigger problems. So we try
the pick it up problem is directly the result of the DA government. It was under Herman Mashaba who insisted on insourcing all of these employees.
I know people are enjoying this, and Kanthan and Jonathan are asking questions that ordinary people in this city want to ask, and I understand the frustration, but I do not want us to pile on to Belinda, who's come on this morning.
I don't think we're piling on to Belinda. I think we're very sympathetic towards Belinda, and frankly, Gareth, we're appreciative of her being on the show and outlining these problems. But what we are doing,
I need to support
solutions.
What Kanthan's saying. I support, I know Belinda works very hard because I have a councillor who works very hard. And generally, councillors are the hardest working people, but they're not the seen people. And that was my point about who should be the next mayor the next time the DA comes into power. I don't want someone who hasn't been involved and who doesn't know what it means to be a resident on the ground and to suffer with these issues. I want a councillor who's been battling these issues for years and who's willing to take hard measures and isn't a face for the DA. I don't care about the DA's faces. I'm done with that. And frankly, you can tell all your councillors in your next meeting and all your colleagues that if they carry on doing this, they're losing people's votes. That's the reality. And it's nothing against you as a councillor. You do your job. I will carry on voting, I might add. My vote is not for the DA. It's not necessarily for the DA. I'm not saying it's not up for grabs, but it's not necessarily nationally up for the DA. But my local vote, I will vote for my DA councillor just because she's very good. If she changed party, I would vote for that party. She's exceptional.
I'm in the
and
same boat. I've
that's
voted
really
for the
point.
DA councillor in my suburb as well.
It's interesting. I've also got a female DA councillor. I've got to say that the women are really standing their ground and doing a fantastic job. I know a lot of men who are in local government are doing a good job too, but it seems to me that there are exceptional women, especially in the DA, who are trying their damnedest. And you know what, Belinda, well done to you. I think what we've done here is we've kind of started a campaign for you, whether you like it or not. I know you didn't come on to do this. But whether you like it or not, now you're going to be a candidate. So let's just talk about what's going on at the moment, because you are in council. You can tell us a little bit about this Al Jamaa or whatever it is party that was they were the party who elected the last mayor, who was, I don't know, he was in for like 5 days or something, and God alone knows what damage he wrought. But what is going on with the mayor of Johannesburg, Kenny Kunene? I mean, give us some clarity here. It seems like an absolute disaster.
I'm not aware of Kenny Kunene being the mayor, but the mayor at the moment is Kabelo Gwamanda. That's the current mayor. Used to be Tapela Ahmad from Al Jamaa. Now it's Kabelo Gwamanda. The mayor's Soka speech, we felt was not only vague, but we could see that he was pulled in different directions, as you would, because if you are a party that has less than 1% and you're having two big parties pulling you around as the mayor, it becomes a problem. I don't believe he's his own person, and I don't believe he's up for the task, in my view. You ask simple questions based on his Soka speech, and he can't answer, and then pulls the race card and tell us about 30 years ago about apartheid, which I believe is an old argument, because we're 30 years into democracy, and it's about people getting services, and it's about you making the right decisions to at least try as much as possible to accommodate what the people want. And the mayor has been missing in action. He hasn't spoken. He's even ran away from the media. And we were concerned on the day of Isoka. It is the first time in the history of Johannesburg that an executive mayor was not giving a press interview. He left under the guise that he's not feeling well. And we said, okay, we'll give him the benefit of the doubt. But the DA, I asked this chief whip of the DA to please write and find out if it's got a medical certificate or everything. We saw him pop up and opening some other community centers. So my view is that the mayor is not up to the task. At least if he would at least be open and transparent about some of the challenges. Nobody's perfect, but he's not even open and transparent, and he's being pulled by the nose by the ANC and the EFF.
What a disaster. What a disaster.
We have a disaster on our hands. We seriously have a disaster on our hands, and it's residents like you, me, who's going to feel the heat when this 80 billion rand budget that has been passed, you're not going to see any difference on the ground. And that is exactly what's been happening.
Well, I have a very practical solution to offer right now to everyone in the city of Johannesburg. Go off grid in terms of electricity, and then stop paying your rates. It'll fix the problem very quickly.
So I just maybe as a last point, Gareth, I know we're running out of time, but I just want to point this out. My area and in a bordering area are busy looking at doing exactly that, Kanthan, whereby the entire area will stop paying rates and taxes. It will be paid into a trust account with lawyers, with attorneys, and we will go to court against the city. You will get not a cent from us. We will still be paying our rates and taxes, so good luck cutting us off. And it will be subject to a pending court matter, and we will be going to court to basically say you're not providing services, so you no longer get any money from us. And frankly, that's what everybody should be doing. We should be cutting off funds from the government. You don't need any of our money. And as you were mentioning there, Councillor, the reality is I don't really care who the mayor is. I never want to know who the mayor is. It's not important. I don't need to know who the mayor is, who the MMC is. They shouldn't have official Twitter accounts. They should have nothing, because they shouldn't be doing anything I need to see, right? They should be fixing the frickin' roads, fixing the pipes, making sure the sewage happens. I don't care. It's a job.
Cleaning
It's
up
a
the trash. Absolutely.
You are not important. Your name is not important. Your title is not important. You are not an important person. You are a person who has been voted in to do a job. Do the job or get out.
Right. Okay. Well, you
Gareth,
get the last word. Councillor, you get the last word. Go ahead.
Gareth, just one thing I would say, unfortunately, I can't be a proponent of not paying rates to the city. That
No,
you're on your own there. But I must say that this is one of the issues I questioned with the executive mayor and the MMC of Finance. He's got this brilliant budget without telling us exactly where it's going. City Power has been a problem child. It was 6.5 billion in the red when we got it, when we were in government. And one of the mistakes, and I said to colleagues that we did, is that we said we're not going in when Dr. Palazzo was the mayor. We're not going to come in and say, this is what we found, we're just going to try to fix it. And that is when we started the process, obviously having the energy in Daba, having the IPPs, trying to send out RFQs for requests for proposals for IPPs and making it easier. And that is for independent power producers to avoid this rate boycott and people going off the grid, because if you provide services, people are ready to pay. People are really willing to pay. And I said to the MMC yesterday, where are you going to get the money from the ratepayers when people are going off the grid? It's an unrealistic budget. You cannot, you're not going to be able to get the money that you are projecting because people are going off the grid, because people are tired of promises and they want services. So this is one of the things that we questioned the other day, but I can tell you much more, that the issue of fighting for you and getting at least rebates on some of the issues where you are saving the city money is something that the DA obviously will be fighting for quite a bit. And some of the other issues like revenue generation, like outdoor advertising, the precinct planning that they are proposing as well, which was started by us, which they voted against, and making it easier to generate revenues in those precincts, which will be policing as well.
I'm going to have to draw this to a close, but thank you, Councillor. Councillor Belinda Kayser-Echeozonjoku. I'm going to do this. Belinda Kayser-Echeozonjoku. Thank you so much.
Please tell us how you say your last name.
It's Belinda Kayser-Echeozonjoku.
Thank you. I really did my damnedest, but I'm obviously useless about this. But thank you very much.
Thank you so much, Gareth.
Thank you, ma'am.
Bye-bye.
And Kanthan, always good to see you. Thank you very much for being on. And Jonathan, thank you for explaining the NHI to those of us who are still in the dark or choosing to be ignorant about it.
Gareth, I suppose the biggest thing probably people can do is just talk about it. Just talk about it and make it a topic. Make it a topic of discussion at work, at home.
And go to these meetings. Like Kanthan said, we can go find out.
Make it a central issue.
Whoever your medical aid, hold their feet to the fire, for God's sake.
Yeah, make it a central issue, because whether you like it or not, it's going to be a problem.
Yeah. All right. Well, thank you for clearing it up. Good to see you both, and thank you for joining us this morning. If you were listening to us or watching on YouTube, make sure you like and subscribe. We will see you in the Burning Platform. I'll be back in a week from now, so stick around. We'll see you soon. Thanks, everybody. Cheers. Bye-bye.